Hi there, my name is Sarah Johnston, and this is for my assignment on myofascial lines. I'm going to go through the superficial front line, superficial back line, lateral line, spinal line, and unique things about the back functional line and front functional line.
Okay, so the first thing we're going to start off with is the superficial front line, which is the yellow, and the superficial back line, which is the orange. So I'm going to start off first with the superficial front line. So this runs the anterior portion of the body from the feet all the way up to the pelvis, and from the pelvis all the way up and around the side of the skull. So the balance purpose of the superficial front line is to balance the superficial back line. It helps lift the pelvis, the rib cage, and the face, and protects the internal organs of the ventricle cavity, and also helps maintain the postural extension of the knee. The movement purpose is to create flexion in the trunk. So flexion is the forward movement in the trunk and the hips, and extension in the knee, and dorsiflexion in the foot. So it would be flexing the foot and extension of the knee. Okay, so we're going to run through this. The orange sticky notes are where the stations are, and the pink sticky notes is where the tracks are. So we're going to start off here, the very first one, which is the dorsal surface of the phalanges, which runs into the short and long toe extensors, and that runs into the tibialis anterior tendon and to the tibialis anterior muscle. That runs into the, sorry, I'm going to try to get this guy to stay still. That runs into the tibial tuberosity, which then goes into the subpatella tendon and into the patella. And then from there, we're going to run up to the rector femoris and the quadricep muscles, all the way up to the anterior inferior celiac spine, which is actually supposed to be this right here. So that's the first portion of the track. Next one is starting at the pubic tubercle and runs up where the rectus abdominis muscles, all the way here, which then runs into the sternocondra fascia to the fifth rib, and from there it goes into the sternialis, to the sternomanubrium, and then that runs into the sternocondomastoid muscle, all the way up to the mastoid process, and then that runs into the scalpia fascia. So now we're going to go to the superficial back line of the skeletal muscle, of the train, anatomy train. So this here runs from the bottom underneath the foot all the way up to the knee, and from the knee all the way up to the head and around to the brow. It's all the way up front there. So the postural purpose of the superficial back line is to keep the body upright and maintain the upright position, and to prevent the body from curling into flexion. So it keeps our body nice and straight. The movement functions is to create extension and hyperextension in the neck and the lower back, flexion in the knees, so that allows us to bend our knees, and the plantar flexion in the ankles. So as a baby, we develop extension movement by trying to lift our head and our neck. In this, we develop opposing curves that help create balance. So our secondary curves, in other words, which is at our neck, our lumbar spine, our knees, and the bottom of our foot. So in these secondary curves is where we can find most dysfunctions. So this is something that we learned in biomechanics. So if we're looking for any postural imbalances, the secondary curves are the most common places to look. So we're going to start at the very first station. So this is at the bottom of the foot here. So we start off at our plantar fascia and our short head flexors to our calcaneus, and that runs into our Achilles tendon and our gastrocnemius, up into our condyles of the femur, and that runs into our 3 hamstring muscles, so you can see it splits on both sides, all the way up to our acelia tuberosity, into our sacrotuberous ligament, which is there, and then that runs into our sacrum station, and then that runs into our sacrolumbar fascia, which is the fascia that covers this portion of the back, and runs all the way up the erector spinae muscle, and then that goes all the way up to the occipital ridge and around the head to the gala neurotica to the very front of the head at the supraorbital ridge. So that's our falling apart here. So that's our superficial back line or our superficial front line. Okay, so this is the lateral line. It runs all the way on the lateral side of the body from the bottom of the foot all the way up, splits into 2, and goes to the lateral side of the skull. So its purpose is frontal plane stability. Its postural function is to balance the front and back side, and bilaterally to balance the left and the right side of the body. It mediates forces among the other superficial lines and acts to stabilize the trunk and the legs in coordination to prevent them from buckling. Its movement functions, it helps with lateral flexion of the trunk, so lateral flexion, moving side to side, abduction of the hips, eversion of the foot, so eversion moving like this, as well as it acts as an adjustable brake for the lateral and rotational movements of the trunk. So the orange, we're going to start at the very bottom here. So the orange sticky notes are the stations, and the blue are the trains. So we start off with the first and fourth metatarsal bases, and that runs into the fibularis muscles. So it runs along the side here of the leg, and that goes into the lateral tibial condyle, and then that goes into the anterior ligament of the head of the femur, and then the femoral head. So then running alongside the body, goes into the IT tract, splits into 2 into the tensor fascial, and then that connects to the ASIS, or the anterior superior celiac spine, and then the other direction goes into the gluteus maximus, and that connects to the posterior superior celiac spine. So starting off from the PSIS, we're going to go up into the lateral abdominal muscles. And here it connects to the stations of the ribs. So it goes here, here, comes back over. So you can see where it crosses on both sides. And then from the ASIS goes up the lateral abdominal obliques and goes side to side and crisscrosses. So the station points in the ribs are from 5 to 12. And the muscles are the internal and external obliques. So from here, this runs into the fourth thoracic vertebrae, and then from there into the spleenalis, carpitis, cervicus. And then that goes into the mastoid process just behind the ear. We're going to go back down here. So from here, I think it's the 5th rib, it runs into the cervical manubrium and then the sternocleidomastoid muscle all the way to the back of the occipital ridge. So that is the lateral line. This here is the spiral line. So it goes all the way from the top of the head throughout the body, around with a double spiral, which helps maintain balance in all planes of motion, so sagittal, frontal, and transversal. It connects the foot arches here to the pelvis, and that helps determine efficient knee tracking while walking. If there's any imbalances in the spinal line, the spinal line creates, compensates for, and maintains alignment in twist rotations, as well as lateral shifts in the body. For movement functions, it creates and mediates obliques, spirals and rotations in the body, in concentric and isometric contractions to prevent trunk and leg from folding into rotational collapse, and to modulate strain in the arch system. So in here is where the arch would be, in the arch system of the foot. So starting off from the first point, the top is the mastoid process, and then goes into the spinalis capitis and cervicus, and then wraps around the body here, connecting into the vertebrae, going to the rhomboid majors and minors, connecting to the medial border of the scapulus. And it goes, hard to see, but it goes underneath the scapula to the serratus anterior, to the lateral rib station, connecting to the external obliques, and coming around here to the abdominal aponeurosis fascia here, and then keeps going to the internal obliques, to the anterior superior iliac spine, which then goes down, all the way down through the tibial fascia and the IT tract, and it goes all the way here. So this goes to the side of the lateral tibial condyle and goes across to the tibula anterior and to the tibula anterior tendon, which would be right here, which then connects to this first metatarsal base and goes around, comes back up, and connects to the fibrialis longus, which then connects to the fibrillar head, and that goes up to the bicep femoris, connecting to this ischial tuberosity, and then that runs up to the sacrotubularis ligament, to the sacrum, to the sacrolumbar fascia, to the erector spinae, and then that goes all the way up to the occipital ridge. So connecting that on both sides creates the spinal line. So this is images of the back functional line and the front functional line. So what is unique about these is both reveal the same continuous line of pull running across the body, linking up each upper limb with the lower limb. So this one is the back functional line, this one is the front functional line. So the opposite lines work in cooperation, one lengthening while the other shortens. So here is a depiction of what a line of action looks like. So the top one here is, it depicts the left back line, so right here, as it shortens. So as the person is going to pull back, this line here is going to shorten, while this one lengthens right here. On the bottom one here, this depicts the lengthening of the right line, so right here, and then the shortening of the left line right in here. So you could also think of someone doing a baseball throw or a discus throw, and it's going to have this same line of action where one side of the body here is going to be lengthening while the other side, when one side is going to be shortening while the other is going to be lengthening, or one is going to be lengthening and the other is going to be shortening.